Hello, I am Dr. Mirela Cernăianu, and I welcome you to the Wellness Optimizing Warrior MD podcast, the WOW MD podcast. I am not your typical wellness coach, and this is not a typical wellness podcast. Here, I'll discuss educational facts about health, hormones, intimacy, anti-aging, and beauty trends, all very hot topics, to empower you to make great choices when it comes to your health and to your body. I want you to go, wow, I did not know that. Or, wow, this is going to make a great difference for me. Our healthcare system is broken and it needs a revolution. You and I can start one today. I am willing to share my knowledge with the world if you're willing to listen. Let's get started. Hello, listener, and welcome again to another episode about the thyroid. This episode is specifically about what is the best thyroid dysfunction treatment, specifically referring to hypothyroidism. This podcast episode will be reasonably brief and to the point, and I will strive to educate you, my listener, on what is not just the best therapy available for thyroid dysfunction, hypothyroidism specifically, but also discuss all the therapies available. What I'd like to do right from the beginning is establish that there are two categories of patients requiring thyroid replacement, and their individual thyroid replacement will be slightly different, and the monitoring and surveillance of these patients is also slightly different. Category number one are people who no longer have a functioning thyroid gland. These people rely solely and purely on thyroid replacement therapy. The reason maybe their thyroid gland is missing because it has been surgically removed for a problem, it's been radiated for Graves' disease, it's been removed for cancer, etc. It might have unfortunately been replaced with scar and fibrotic tissue from an autoimmune thyroid condition, and all that's left is non-functioning tissue, again, from years of autoimmune antibody attacking and destroying the normal thyroid tissue. The other category is the people who still have functioning thyroid tissue left. Let's talk about the first category, the people with no longer any functioning thyroid tissue. This category of people rely exclusively on the medication that is being provided to them. That means they do not have any natural production of thyroid. There is no give and take, and their bodies are unable to regulate any thyroid production to match their needs. What that means is that if you're on a fixed thyroid dose and you have no functioning thyroid tissue, if you start exercising more, or if you stop exercising completely where you were exercising before, your thyroid medication will need to change because the medication that you're taking now will no longer reflect your needs. If you don't adjust your medication, this will likely make you feel imbalanced and poorly. And again, those type of people have to be aware of this situation. They will need very close monitoring, and anytime they undergo lifestyle changes or major drastic health changes, their medication will have to be adjusted by the physician who's taking care of them. And if you're one of those patients, you need to be educated to know that when you start feeling poorly and there's been a major lifestyle change, you need to go see your doctor and have your tests run ASAP. Thinking, well, I've been on the same thyroid medication for many years, I feel fine. It's not the thyroid. It must be something else. It's not good because it's ignoring one of the most important, crucial aspects of your health, the optimal thyroid replacement. If you feel fatigued, if you keep having weight issues, hair, skin, digestive tract issues, mood issues, definitely have your thyroid medication and your thyroid levels monitored, because even if the thyroid might not be the culprit and you're doing the perfect amount, you would be much more prone to ups and downs and weird swings in your hormone levels. And if you don't have the optimal thyroid replacement, this will impact everything else, your adrenal health, your sex hormone health, etc. So how do you know if you have any functioning thyroid tissue left? You might want to know. Well, a very, very simple clue is the amount of thyroid medication that you require. For example, if your total Synthroid need is over 150, or you need over 120 or 150 of Armour medication, then you most likely have very little or no functioning tissue left. It's much more likely that you have no tissue left if you need more than 200 of Synthroid and over 150 of Armour, which is desiccated porcine glandular thyroid. More to come on this subject in a few minutes. The second category are the people who have a remaining thyroid left. It's just that their thyroid function is not optimal. So they use thyroid replacement so their bodies feel optimal. Those are the people who take a dosage of T4 that's under 100 milligrams or a dosage of Armour thyroid that's under 120. Most likely, if you are on this dose of medication, you probably have some sort of tissue left behind that can help you balance the ups and downs that the changes in your lifestyle or health can bring about. We did this short introduction and explanation about these categories of remaining thyroid or no functioning thyroid, which I think is pretty important. So let's get into the nitty-gritty of thyroid treatment and what are the best options. Well, let me start with the most common treatment option that you might be offered by most physicians. That is T4 only treatment. That means you will be offered Synthroid, levothyroxine, Levoxyl, Thyroxine, etc. There are many physicians, and I'm going to be very upfront and clear, these are specifically Kaiser physicians. There are other PCPs, like family practice physicians and endocrinologists, who refuse to consider any T3 treatments or any other type of treatment except for T4 treatment. So let's discuss this T4 treatment option in detail. If you have listened to my previous thyroid podcast episodes, then that's great. You're up to speed. You probably know by now that T4 or thyroxine is an inactive thyroid hormone that does not do anything in your body. It does not have any cellular action and does not affect target cells in any way, shape, or form. It will need to be converted to your active thyroid hormone, which is your T3 hormone, triiodothyronine. In a perfect world and a perfect body, this conversion rate would be optimal. So there should be no issue with T4 only treatment. However, in the real world, in an average thyroid, in an impaired, stressed out, nutritionally deficient, overweight body with mitochondrial dysfunction on top of everything else, most likely the conversion rate from this inactive T4 hormone that is being provided as treatment into the active thyroid hormone that you need will not be optimal. That is reality. And that is why T4 only as a treatment option is not a good option for quite a large number of patients. And you might be one of those. How do you know if you are what's called a poor converter and your conversion from T4 to T3 is not happening at the optimal, ideal rate? So how do you know if the T4 treatment you are getting is ineffective and not working for you? Well, that's very simple. It's a very, very simple answer. You would take the T4 medication, you would feel not a whole lot of difference in how you feel. This is the number one situation. Basically, you go to the doctor, you get started on thyroid medication, there's a little bit of an improvement at the beginning, then you come right back to where you were before. It's still impossible to lose weight, you're still tired, you're still foggy, you're still anxious or depressed, etc. And if that's the case, you should know that T4 only treatment is not the right option for you. The second situation is when T4 only works well for you, but only if it's in a very, very high dose. The high dose of T4 can possibly increase the rate of conversion and provide the necessary T3 amount that your body requires. If that's the case, then when you check your blood T4 levels, your T4 will be very, very high, close to the top range of normal or over. but your T3 level would be close to mid-range or above it. And obviously, your TSH will be extremely suppressed by the massive amount of T4 hormone. So it'll be very low, well under 0.1. It might even be another zero there, like 0.01 and below. So the question to ask is there a problem if there is so much T4 in the system? We have the right amount of T3, so why do we care? Well, there is a problem because the exaggerated amount of T4, the very high amount of T4, might actually promote the conversion from T4 into the reverse T3, which is the opposite, mirror image, identical, what's called an isomer of the active T3 hormone. But the reverse T3 is not an active hormone, is also an inactive hormone that will literally bog down the system because reverse T3 can and will attach to the T3 receptors. And then the normal T3 active hormone will no longer have access to these receptors. The problem is the reverse T3 does not activate the cellular actions that the active T3 hormone does. Please remember this. Go back and rewind it and listen to it again. Checking your reverse T3 levels is crucial when you receive T4 only therapy or high dose T4 therapy. I did not speak about the reverse T3 testing in my previous episode because I wanted to make this point and let it sink when I talked about the therapy. There's also another problem with super high T4 levels. I'm not going to address it into this podcast, but I'd like to mention it. There have been some studies and concerns that the excess T4 can stimulate thyroid cancer cells and that there is a thyroid cancer risk associated with T4 therapy. There is a concern that excess or very high thyroid hormone levels can and will stimulate various cancers throughout the body. I honestly had no clue that this is the case until one of my super educated patients that is actually an expert right now in these matters because she is being treated for thyroid cancer with a holistic practitioner in a natural way with some strange out there protocols. I am her supervising physician at this point, and I am managing her T4, T3 replacement. So when she came to me and explained she'd like to get off the T4 and explained the reason, of course, at the beginning, I was like, what? I got to look into this. I did look into it. And as it turns out, all you have to do is Google T4 therapy and risk of cancer. And there's significant evidence that's been published in the past couple of years. And there's apparently been evidence around existing and published and discussed that higher free T4 levels are associated with an increased risk of any solid cancer, lung cancer, prostate cancer, breast cancer, etc. So again, I looked this up, and as it turns out, there is some truth to it, and it's pretty wide known. All you have to do is research, Google risk of cancer in long-term T4 users. There will be a lot of information popping up. And again, thyroid disease is a major public health problem, and the number of individuals that have thyroid disease is expected to continue to grow. So the need for thyroid replacement is going to continue to grow. Again, T4 therapy is the first line treatment for hypothyroidism. It's the treatment that has been used by many physicians for decades. There have been some really serious concerns about the correlation and the safety of long-term T4 replacement therapy and its connection to increased risk of cancer. So again, like I said, this is not for this podcast. We're going to move on. And I just wanted you to have this information so you can probably wow your provider with it, because I bet you your doctor doesn't know about it. Or if he does, he's definitely in a better place than I was when my patient confronted me and asked me to look into it. We talked about T4 therapy. Well, what about treating thyroid dysfunction with T3? Let me tell you what the main argument all the naysayers against T3 therapy will use when they argue against it. The main argument is that the available T3 products on the market are very short-lived. They only last a limited amount in the body, 4 to 6 hours. That is correct, and that's why a lot of my clients that use T3 are taking 2 doses, one in the morning and one in the early afternoon. I have no idea why we providers think that the patient can take Tylenol for pain or blood pressure medication twice a day or a beta blocker for heart rhythm issues twice or 3 times a day, but we can't take thyroid medication twice a day. This objection of the T3 treatment not working because it's short-lived in the body can easily be overcome by just taking T3 a few times throughout the day. And this might be necessary, and it is something that I use a lot and very often with some of my clients. Now, there's a minority of patients that are treated only with T3 therapy. They usually require a high dose of T3, 25 or more. Those people are usually the exception, and there are rare cases where they only tolerate T3 therapy. T4 does not work for them at all, and it makes them feel terrible. And they're pretty happy on T3. And at that point, I always caution them, hey, let's split your dose in 2 because you're likely going to feel a lot better. Now, there's a large majority of people who use a combination of T4 and T3. And the majority of patients do so by taking both hormones first thing in the morning on an empty stomach. Again, a minority of patients are actually treated by providers who understand thyroid a little better, and especially if they have symptoms of thyroid deficiency and they take their morning dose, they might be given a second dose of T3 either before lunch or early afternoon, again, 6 to 8 hours from the first dose. Adding the T3 medication to your thyroid replacement treatment is likely to be beneficial for the great majority of patients, and it's likely to improve the way you feel, especially if you're one of those people that cannot convert T4 to T3 in the optimal, ideal manner or at the rate that's going to reasonably impact your body optimally and make you feel good. If you are on T4 only treatment, Synthroid, levothyroxine, Levoxyl, and your doctor does not want to add T3 and you still feel poorly, it is time to change physicians and look for another doctor. Let's continue our chat about thyroid treatment options. We talked about the synthetic T4 and T3. Well, what about the natural thyroid? What about desiccated porcine glandular thyroid, also known as armor thyroid, NP thyroid, nature thyroid, West thyroid, etc.? Many people prefer desiccated porcine glandular thyroid, or natural thyroid, as it's called, because they feel better on it. Well, why would that be the case? Well, I'm going to tell you right now, so please listen. The easiest explanation is likely because the ratio of T3 to T4 in the medication is actually in favor of T3. And the porcine glandular thyroid extract contains this ratio of T4 to T3 similar to what normally exists in our bodies. Also, the large majority of patients that take this form of therapy, they prefer it because they do feel it's more natural as opposed to the synthetic mass-produced T4 and T3 medication. However, keep in mind, Armour, NP thyroid, etc. are still produced by manufacturers, and it's still through a chemical process. And they've been on the scrutiny of the FDA quite a few times in the past 3 to 4 decades. Now, you might be one of those patients that used to use nature thyroid. And now nature thyroid is no longer available on the market, as the manufacturer for it has been shut down by the FDA a little over 5 years ago. A question about not the purity of these products, but the actual amount of active medication that's supposed to be present. I think it's supposed to be within the 95th to 98th percentile, or something like that of what the bottle should say on the label. And I guess the issue FDA had for some of these products, because I used to carry Thyroid and I would get the FDA warning and notices that some of the bottles were tested and were at 88 percentile instead of 90 percentile. Now, I'll be honest, the patients that were treated with the Thyroid loved the medication and the way they felt. They didn't care that it wasn't 90th percentile or above and their medication on their bottle was 88 percentile. They liked it, it worked for them, and they felt great. Unfortunately, that's no longer available, but we have Thyroid or Armor, which are more easily available now. Most of the patients that were on Thyroid have switched to Armor, and some of them switched to synthetic T4, T3 combinations. We talked about the natural thyroid, that's the desiccated porcine glandular extract. We talked about the synthetic T4, most of you are familiar with. It's called Synthroid, levothyroxine for generic, Synthroid for brand. Again, keep in mind, Thyroxine is only T4, and it's a synthetic product, but has a much more pure formulation with less strange ingredients. So some patients prefer Thyroxine if the insurance covers, if they can find it, and sometimes they're absolutely willing to pay cash for it because it's the only thing that works for them. The synthetic T3, it's also called liothyronine and also known as Cytomel. That's the brand name. To end the podcast, let me mention that we also have compounded T4, T3 medication available. Compounded thyroid formulations follow the same pattern. They could be either synthetic T4, T3 combinations. The only benefit is you could compound T4, T3 and get it in one capsule versus just taking two capsules, one for T3, one for T4, or two little tablets. You can also compound desiccated porcine glandular thyroid. And that is advantageous, for example, when someone needs a dosage that does not exist. An Armor thyroid maker or the NP thyroid does not make it. For example, the available dosage for these medications is only 15, 30, 60, 90, 120, and 150. So if you need 45, 75, 95, 135, then you're out of luck. You will have to be prescribed two medications, a 30 and a 15, a 60 and a 15, and etc. The problem is that for some reason, the insurance does not cover both medications in this porcine glandular class. For example, should you need 45 milligrams of Armor thyroid and you had previously been on 30 milligrams, and we talk about your symptoms, we look at your labs, and we decide, okay, you need 45, maybe the 60 will be too high, or you've already tried the 60 and it's too high, then the patient will have to get two separate prescriptions, a 30 and a 15. Apparently, the insurance will not cover the 15 and will only cover one. So compounding desiccated porcine glandular thyroid, it's advantageous because you have one capsule, not two, and it's actually cheaper than using two capsules, especially when insurance doesn't cover. So coming back to the question of which therapy for thyroid is the best. Well, the answer is very simple. Whatever works to give you the best results is the best therapy for you. And that might take a little trial and error at the beginning. However, if you have been on thyroid medication and you do not feel that it has been helpful, please consider talking to your doctor about changing to a different type of medication. If your doctor is not willing to change your medication, then it's time to change physicians. There's a couple more things to say in this podcast before I end it. For example, one of the things you should know is that T3 is much more powerful than T4, obviously because that is your active hormone. For some patients, they cannot tolerate T3 easily. They develop palpitations and anxiety. So not everyone is a candidate or can tolerate T3 replacement. But that is something that will be discussed and hopefully disclosed or addressed during your visit. Checking your reverse T3, looking at the inflammation markers, looking at mitochondrial dysfunction. It's important because T3 therapy is likely to help in these cases. I will end here, but if you have any further questions about thyroid, about what is the best replacement, and you'd like to discuss this further, please feel free to become a member of our Facebook group, The Wellness Optimizing Warrior MD. The link to request access to the group is in our show notes. Just scroll down, you'll find the link. If you listened to this episode and you thought Synthroid or levothyroxine is the only thyroid medication available just because you're on it, hopefully this opens your eyes to other possibilities, especially if you're on a medication that is not rocking your world. Until we meet next week, and best wishes from me and my team for the holiday season in 2023. If you liked the information you heard and you'd like to hear more, please subscribe and follow my podcast. Should you find the content helpful to not just you, but possibly others, please share it and feel free to leave us a review. You are welcome to join the Facebook group, The Warrior Optimizing Wellness MD. I certainly hope that you've heard many things in this podcast that made you go, wow, I did not know that, or wow, I'd like to know more. So keep listening and I'll keep talking.